The colon is about as long as you are tall. So if you're 5 feet tall, there is about 5 feet of large bowel. If you're 6 feet tall, there's about 6 feet. The purpose of the colon is to take about 1.5 pints of liquid stool, making it more concentrated. Now, there are normal activity of the colon that allows us to have bowel movements. It's common to have 1 bowel movement a day, or it's not called constipation. You can go 2 and even 3 days without having a bowel movement without us calling constipation. Now, in the colon, there are several things that go on. Number 1 is constipation. That's usually people who are inactive, they're not eating properly, they're not eating good food, and we tell those people to be active. They exercise, they eat more roughage. What's roughage? Well, if you look for fiber on foods like oatmeal, like pears, apples, green leafy vegetables, all those have a lot of roughage. And that's very, very important as we get down to the GI tract to have normal bowel habits. There are a lot of people that have cramping abdominal pain. Their abdomen just fills up with gas and they cramp. We call it irritable bowel syndrome. It's where the peristalsis, the contraction of the GI tract, doesn't time itself properly. And therefore there are pockets of gas and cramping pain and bloating. Again, those are symptoms. If they persist, you should most likely see a stomach specialist on. But exercise, increased roughage, eating regular will help that. Further on down in the colon, there are what we call diverticula. They're little outpouching. They're normal. Almost everybody has some diverticula. They're about the size of the end of my finger. The problem is if those diverticula get infected, then that's called diverticulitis. Painful, cramping, bloody stool, fever. That can be a very serious thing, diverticulitis can. So if you've got cramping abdominal pain and you've got bloody stools and fever, you must see your doctor immediately. Cancer of the colon, third leading cause of cancer death in the United States. We need to start getting colonoscopy at age 50. That's where they can examine the whole colon. Why do we do that at 50? Because if the doctor finds little small polyps, we call them adenomatous polyps, they can remove those during the procedure. If they're not removed over a 10-year period of time, those will become cancerous. So know that you need to take care of your colon. It's an important part of your life.